Mojo, how are you? Hey, Jesse.
Jesse, how are you doing?
Yeah, cool.
Nice.
Okay, we are going live on Facebook now. Yes, good afternoon, everyone.
Good afternoon.
Good afternoon and welcome to our meeting this afternoon. We will have the national anthem now and then we will begin our meeting. So let's all stand for the national anthem.
Video going on. What is premiere now? Do you know what's premiere now?
Thank you very much, everyone. I would now like to invite Zakia Moray to lead us in prayer. Zakia.
Pleasant afternoon to officers and members. Almighty and most merciful Father, we come once again in your presence to give you praise, to give you thanks, to give you glory. Father, we take this opportunity to thank you for education, blessed Lord. Father, you continue to open the 7 lockets of our brain that we will be able to retain whatever is taught to us. Father, we thank you for the facilitators. We thank you for the Laramie Diabetic Association. We thank you for each and every member, Lord. And we just want to ask you that we'll have a good meeting this evening and that we'll learn something new today. In no other name but in your almighty name. Amen.
Thank you very much, Zakia. Again, good afternoon, everyone, and welcome to our meeting this afternoon, our meeting for the month of September. I trust that we are all in good health and good spirits. All right, so at this point, again, welcome, and I'll invite our education officer, Dira Satnarayan, to introduce our featured speaker for this afternoon. Dira?
Nizam, I'm really welcome.
Oh, okay. Take it away.
All right. Good afternoon, everyone.
Good afternoon.
I would like to welcome today Mr. Ravello. She has been a registered nurse for 16 years. She has specialties in cardiology, critical nursing, which Johns Hopkins University, USA. Holder of a bachelor degree with the University of the West Indies, Trinidad, specializing in nursing education. She has extensive experience with nursing, education, health literacy, health promotion, and patient education. Nurse Ravello developed the pre-assessment clinic at San Fernando General Hospital in 2019 and currently holds the position of head nurse of the Coronary Care Unit, San Fernando General Hospital. Nurse Ravello has a passion for nursing and education, has a friendly, caring disposition with a willingness to always helping others. Ms. Ravello, we welcome you today.
Thank you so much, Ms. Vera.
No, Natasha.
Natasha. I'm mixing
No,
you up.
No, we had a little change in the presenter this afternoon.
Okay, no problem.
Okay, take it away.
So it's a pleasure being with you all. I really love patient education. I love teaching patients. I love teaching nurses. I love teaching on the whole, but I decided to be a nurse instead. So this evening I was asked to speak about a nice topic that I really like, cardiology and cardiovascular diseases. And I'm going to share a screen with you all because I prepared a PowerPoint presentation. So during the talk, if anybody has any questions or anything like that, you can feel free and stop me. Or if you prefer to the end of the session, that's quite all right as well. If you're not hearing me, just let me know that you're not hearing me. I'll speak up a little bit louder. And we're just going to have a good time this evening, all right? I'm sorry that Mr. Gums is not here because I was looking forward to seeing what he looks like. I'm going to correspond with him by email, so I don't know what he looks like at all. I saw his picture on the profile, so I was kind of, hoping that I would get through with him this afternoon. Oh, I'm kind of having some problems sharing. I'm having some problems sharing my screen.
Maybe Farah can help you. Farah?
Zoom did a recent update. If it is you're sharing a file, it have advanced settings or file settings, and you could see if you could select it from the PowerPoint presentation.
Okay. I'm not getting it.
I'm not seeing the camera and things.
So I'm not getting in. How? I never had problems like this before. Select. Okay. I'm really not getting on.
Okay, well, what happened is that Farah said they did an update on Zoom, so probably that is why you're not getting through.
I've never had problems to actually
share your screen.
Share my screen.
We can work with your audio only then.
Okay. All right. Well,
We appreciate that anyway.
okay, hold on a second. Okay, just bear with me.
Sure, no problem. You take your time.
And Ms. Ravello, could you try sending the PowerPoint presentation to my email address, and I will see if I can share it for you.
Okay, no problem.
I'll read up here.
Hello, Isam.
Hi, Ms. Marlene, how are you?
I'm all right, working.
Okay, you have to, we are on Facebook Live, so we'll chat after the meeting. We are on Facebook. Right, so we are waiting on Ms. Ravello to share her PowerPoint with us. So Farah is assisting her with the streaming on the on the Zoom meeting. So while they're doing that, we can just hang on for a little while. It's nice to see each and every one of us, each and everyone with us this afternoon. It's not very often that we have these technical problems, according to Ms. Melissa. So we will just hold on a little while, get that sorted out, and we'll continue with the meeting. God willing. Mr. Birbal, are you back in Trinidad? I'm not hearing you. You're not hearing you, Mr. Birbal. You have to unmute the mic.
There.
Okay,
How's
Mr.
this?
Birbal.
I think I got it now. Thank you
right.
for having me and thank you for inquiring. I'm still back here. I'm trying to get a flight, direct flight, which won't happen until later next month. So I'll probably most likely miss the next meeting, but I hope to be there for November.
November.
See you all in person.
Okay, it'd be nice to have you here.
This particular session is of especially interest to me. You know, I had that.
Yes, I know. For a lot of us in the group at this point will be interested in this particular topic because we are all at some point in that category.
So I'm looking forward to this. I'm trying to get it back on my iPad here so I can see it bigger.
Okay, sure, no problem. Okay.
Okay, well, thanks for calling, and we'll talk to you later again.
Okay, take care. Okay, be good.
Hello to all. Okay. See you guys back in November.
Hello, Mr. Birbal. It'll be nice to have you back with us.
Well, I'm looking forward to it. It's starting to get cold here now, so, so I'm looking forward to getting back to some heat.
And these days it is quite hot down here these days.
It's what like you said?
It's very hot these days in Trinidad.
Okay. No, it's only about 18 degrees here now. So.
Okay.
So, but thank goodness it's no snow yet. So you know, and I don't have to go outside. I had my last rehab session at the hospital yesterday. An exercise session. They put me through a rehab program, and I had my last session yesterday on an exercise machine. Okay. So I'm looking forward to participating in this particular session here.
Hi, Ms. Ravello, are you getting through with the PowerPoint presentation?
Well, we can see comes though. while I've got this. I will unmute my mic again so I don't. Nizam,
Yeah.
I'll unmute my mic now.
Okay, cool. So if Ms. Ravello is not getting through with her. Yeah, sure. Okay, so while we are holding on for Farah and Ms. Ravello to sort out their session there, can we get Anika? Can you do the announcement at this time, Anika? Anika,
Hi, good afternoon.
can you do the announcement at this time while we are waiting for Farah and Ms. Melissa to get their things sorted out?
Okay, no problem. Good afternoon, everyone. The announcements goes as follows. All meetings remain on Zoom for now. Login information will be sent via WhatsApp on the Friday before meetings. Persons interested in joining the group as financial or registered members can contact me at 348-6828. Join the WhatsApp group chat to obtain weekly health tips on management. Contact the education coordinator, Ms. Satnarain, at 350-7956. Our Utah meetings are held virtually on the third Saturday of each month at 3 p.m. To obtain the Zoom link and get your children and grandchildren or friends involved, please message or call Mr. Gums at 757-9116 or UTAM coordinator, Ms. Sealing, at 299-2960. Do you need guidance to manage your health better? Individual counseling is available. You can send a request to diabeteswellness5@gmail.com. Larmin Diabetic Support Group invites all to our movie evening every second Saturday at 5 p.m. Link will be provided. Join us every first Saturday at 10 a.m. of each month, meet and blog. Join our Facebook page and YouTube channel by searching Larmin Diabetic Support Group and subscribing. Virtual meet and greet soon to come. Date to be announced later on. Have a good evening, everyone.
Thank you very much, our hardworking Secretary Penica Grove. Ms. Kojo, can you do the birthday announcement at this time, please? Thank you. Ms. Kojo, our coordinator, hospitality coordinator.
Okay, good afternoon, everyone.
Good afternoon.
For this month, the month of September, birthday greetings. We have 9 female and 1 male. We have 9 queens and 1 king for the month of September. My inspirational, the topic today is really well accent. 11 words the happiest people live by.
Do you want me to share? Do you want me to share the PowerPoint presentation for you, Ms. Kojo?
Thank you very much, Farah. Thank you.
"11 words the happiest people live by." Happy people don't want a perfect life. They just want a happy life and live by these words. love. Love people and use things instead of loving things and using people. When love is defined, it's only confined. Kindness. Be the reason someone believes in the goodness of people. Kindness is not what you do, but who you are. Gratitude. There are so many reasons to just be thankful. Gratitude turns what we have into enough. Forgiveness. When you forgive, you heal. When you let go, you grow. Forgiveness is not an occasional act. It's a constant attitude. Faith. Faith can move mountains, but don't be surprised if you're handed a shovel. Faith makes things possible, not easy. Integrity. Do the right thing, even when no one is watching. A person is not given integrity. It results from the relentless pursuit of honesty at all times. Respect. Treat others like you would like to be treated. Show respect even to people who don't deserve it, not as a reflection of their character, but a reflection of yours. Patience. Patience is not the ability to wait, but the ability to keep a good attitude while waiting. Everything will fall into place. Just be patient. Peace. Peace is our natural state. Never let people or situations destroy your inner peace. Hope. Stay hopeful. You never know what the day can bring. The sun isn't gone. There may just be some clouds in the way. Laughter. Life is better when you laugh often. A smile can even confuse an approaching frown. If you enjoy our videos, please pass this along to someone who may need it. Thank you.
Thank you, Farah. Now we'll have our birthday song.
Happy birthday to you. Happy birthday to you. Happy birthday, happy birthday, happy birthday to you.
Short and sweet. Thank you, Farah.
Miss Kojo?
Yes, Mr.
You calling all the names of the persons who had celebrated the birthday?
Okay, sorry about that. Right, we have the 9 ladies. Mana Bridgelal. We have Sanjay Day, Monisar. We have Miss Joy Jeffers Betel. We have Judy Dinanath Singh. We have Miss Brenda Kamisi Young, Farah Hassan Ali, Simone Grant Lindsay. We have Myra Kamisi Young, Angel Sinclair, and we have Mr. Thomas Grant. Thank you.
Thank you, Ms. Kojo, for that wonderful presentation. Great job as usual. Great job as usual. Keep it up. Keep it up. Thank you again.
Thank you, Mr. Hassan.
I don't know if Farah has gotten through with Ms. Melissa as yet. Just give us 1 second. Let's make a check and see what's happening.
Hi, Mr. Ravello. Are you there?
Hi, yes, I am here. I actually got somebody to come and help me, and I'm ready to share the screen. Everybody seeing?
Right, excellent.
All right, great. So thanks so much, Jade. All right. So let's get started now. So as we mentioned before, we're talking about cardiovascular diseases today, and it is a global problem. It's not as big as the pandemic. You can't wait in that proportion, but it is a big problem. It is a huge global problem. It's one of the things that people not really talking that much about chronic diseases or anything like that. Yes, we have chronic diseases groups and stuff like that, but nothing much in Trinidad and Tobago is done to actually get rid of it or prevent it or anything like that. But prevention is everybody's business. The objectives today is at the end of the session, attendees will be able to discuss the scope of problem, find the condition cardiovascular disease, describe the primary function of the heart, understand the term heart attack, identify its risk factors, signs and symptoms, and explain its prevention, diagnosis, and treatment. According to the Ministry of Health, chronic disease in 2018 and the American Heart Association, cardiovascular disease is the #1 killer for men and women, especially in Trinidad and Tobago and globally. Hold on a second, huh? Right, now I'm able to talk better. So it could strike anybody at any age. Many years ago, they actually used to be saying that, and previous studies used to say that cardiovascular disease actually happens at a later age, but we're seeing it's happening at any age with anybody, both men and women. Most are affected due to comorbidities, and comorbidities is actually different chronic diseases. So you have a whole host, it's not just one. So we're not standing with diabetes alone, we're standing with hypertension, we're standing with diabetes, we're standing with renal impairment. So that's what comorbidities are. And factors leading to cardiovascular disease originate in young women and develop over time and have worse prognosis than men. So this is what recent study is saying. Women actually are the ones who wait too long before presenting to medical attention. I don't know the reason why, but most oftentimes, as soon as a man gets sick, he will go to the doctor. Women, on the other hand, as soon as they get sick, they try to treat themselves at home because, you know, we have the family to see about, we have things to do at home, the children had to be seen about, we had to cook, we had to clean, we had to wash, and we always wait last minute before we go and see about ourselves. Women who have complications due to cardiovascular diseases increases the country's mortality rates, and that's the fact. Fewer women have been included in studies, so there is less data for research internationally, and women's awareness of cardiovascular disease is actually lacking. And the solution for all of this and this major problem is lifestyle changes can prevent or at least postpone complications of cardiovascular diseases. So how does our heart work? And this is a little video that I just want to share with you all.
Your heart is divided into two sides, the left and the right. Blood from your body enters the right side of your heart. This blood is low in oxygen. Your heart pumps this blood to the lungs. Here, carbon dioxide is removed from the blood and oxygen is added. The blood, now high in oxygen, travels back to your heart, this time entering on the left side, where it is sent back to the rest of the body and away from the chain. This continuous process ensures your body receives the oxygen and nutrients it requires.
Great. So that's just a little summary of actually how the heart works. But really and truly, when we think about the anatomy and physiology of the heart, in order to understand a cardiovascular disease or any sort of disease, you must get down to the anatomy and physiology. And the heart is just a muscular organ. It weighs about 250 to 350 grams, and it's located in the middle of the chest. Well, obliquely in the mediastinum. It functions as a pump, and this pump supplies blood to the body, and it takes return for transmission to the pulmonary circuit for gas exchange. So that's what actually happens with the cardiovascular system. It's just a pumping system. The heart contains about 4 chambers that essentially makes up 2 sides of the chamber, an atrium and ventricle with a left side and a right side. We have systemic circulation that originates on the left side of the heart, and it functions by receiving oxygen-laden blood into the left atrium from the lungs and flows one way down into the left ventricle via the mitral valve. From the left ventricle, oxygen-rich blood is pumped to all organs of the body. Pulmonary circulation, on the other hand, occurs on the right side of the heart, and it serves the function of gas exchange. Then we have a thing called coronary circulation, which consists of blood vessels that supply oxygen and nutrients, tissues to the heart. So when we talk about cardiovascular disease, this actually refers a class of diseases that involve the heart or blood vessels, which is the arteries and the veins. And there are many types of cardiovascular diseases, and all of it are largely preventable. So some examples of it, with the types that we're talking about, has an umbrella term. So cardiovascular disease, think of this huge umbrella, and under this umbrella has different types or different terms. So the one highlighted in blue is the one that we're going to discuss today. There are lots, but I can't discuss all in one session. That's impossible. So maybe in another session at another time, you can invite me again and we'll have another talk. But today we're talking about coronary artery disease, or it's also known as coronary heart disease. And this, under this term, we have things like MIs, which is a myocardial infarction, which is a heart attack, angina, which is simple chest pain, CCF, which is congestive cardiac failure. That's when you're accumulating a lot of fluid. We have ACS, which is acute coronary syndrome, and ischemic heart disease, which most people normally attend chronic disease clinics with. We have cerebrovascular diseases, and there's things like strokes and transient ischemic attacks, something that mimics a stroke and it disappears within 24 hours. We have peripheral artery diseases, and these are things that we have persons who have claudication or intermittent claudication, is where sometimes you sit and all of a sudden you start getting cramps in your legs. So this is a circulation problem. And we have aortic diseases and things like atherosclerosis, which we'll talk more of as we go along. Everybody with me so far?
Yes, we are.
All right. So what really is coronary artery disease? It's known as CAD. Most oftentimes we call it just CAD, and it's the most common type of heart disease according to the American Heart Association. It's the leading cause of death for both men and women globally. And CAD occurs when the arteries that supply blood to the heart muscle becomes hardened and narrowed. And because of this, or this is actually due to the buildup of cholesterol and other material called plaque on the inner walls of the heart, and this buildup is called atherosclerosis. I'm certain most people have actually heard the term atherosclerosis before, and plaque building up, because on cable TV and stuff, you would see a lot of medication, being advertised with, treatment for plaque building up in our artery walls and stuff like that. So it's a common term. For coronary artery disease, some patients, when they have it, depending on the number of vessels that are narrowed, we have the term where doctors will tell them you have a single, double, or triple vessel disease. And that only happens when you do diagnostic testing and the doctors confirm what type of disease that you have. With the coronary artery, we actually have different branches on the left side of the heart and the right side of the heart. So the left coronary artery, it has 2 branches. It has the anterior interventricular artery on the left anterior descending, or LAD, some people call it that. And we have the circumflex artery. And then the right coronary artery has two branches as well, the posterior interventricular artery and the marginal artery. So according to when you have a coronary artery disease and these vessels are blocked, then the doctors will tell you if you have single, double, or triple, and which one is blocked, either on the left side, on the right side. When the narrowing becomes critical, the patient could develop symptoms such as angina, which is chest pains, shortness of breath. You can get a heart attack and excessive fatigue, which is tiredness. The coronary artery disease may take years to develop, which is why studies are actually saying now that you can develop it at a young age, or the things that we do at a young age, it causes the progression of the disease. And you may not notice any symptoms until the disease has progressed significantly. And as I told you before, the heart has three main coronary arteries. So who is at risk? I mean, if we're thinking about cardiovascular disease and having it, we need to know the type of people at risk of developing cardiovascular disease. These are very common risk. These classes are risk factors. The persons who are hypertensive, hypercholesterolemia simply means high cholesterol levels. Diabetes, we know. Most of you all know what diabetes is. Mental stress, age, inactivity or overweight. So inactive persons, sedentary lifestyle, people who are not moving around, postmenopausal women at risk. Having a poor diet or poor nutrition, substance abuse like smoking and drinking, race internationally, in the States and UK, they actually look at Asian class type of people or African type of people, but in the Caribbean, everybody's at risk. It's no longer just class as the African people or East Indian, but everybody's at risk right now. Family history, and pregnancy complications, mostly persons who actually having pregnancies later on in their lives, they at risk of having a cardiovascular disease. So how do you treat cardiovascular disease? Treatment is always aimed at controlling the symptoms and slowing or stopping the progression of disease. The method of treatment is based on many factors determined by the symptoms, having physical exams with your doctors, and performing diagnostic testing. In many cases, if the blockage is less than 70% and not severely limiting to blood flow, medications may be the first line of treatment, and of course, lifestyle changes, because this is a lifestyle disease. So now we're gonna go into the actual myocardial infarction that falls under coronary artery disease. And we're going to speak about heart attacks today. Remember, it's a cardiovascular disease is an umbrella term. So the first one we're talking about is coronary artery disease. What is a heart attack? When you really think about it, we hear everybody talking about heart attack. Anybody could tell me what they know just off the top of your head or past experience, what is a heart attack?
I believe that's why you're not getting enough oxygenated blood to your heart.
Yes.
And that causes your heart to be clogged up and you're not getting what you need to function, hence the reason why you're saying your heart attack.
Exactly. That's exactly what it is. So when blood flow to a part of the heart muscle is blocked, usually by a blood clot, a heart attack may occur within minutes to hours. And this is where we call it a circulatory problem. If the clot cuts off the blood flow completely, the heart of the muscle supplied by the artery dies, which is what most doctors would say, you have ischemia. So that's when it dies off. So in the pictures, you would see the blood clot developing. You will see cholesterol plaque building up, which is atherosclerosis. You will actually see the main arteries running along on the outside of the heart muscle. And when you see the plaque building up, you see how much it actually closing in and getting narrower, so blood cannot flow. So when that actually blocks, that is what is going to cause a heart attack. So you start off having chest pains, it's going to cause off that blood supply, and that part of the heart muscle dies. So sometimes you hear people talk about heart attack and they talk about cardiac arrest. Can anybody tell me what you understand a cardiac arrest to mean?
Um, I'm not sure. It's probably when the person is not getting enough oxygen and you have to, they lose consciousness.
Yes, they do. Cardiac arrest is an electrical problem. And just a while ago, we spoke about having a heart attack, and a heart attack is a circulatory problem. So cardiac arrest is an electrical problem. This is a sudden malfunction of the heart's electrical system, causing the heart to stop beating within seconds. So if we go back, we'd remember that the heart attack actually happens within hours. It takes time to build up. With a cardiac arrest, it doesn't take time to build up. It's something that happens suddenly. Sudden malfunction of the heart. It just causes the heart to stop beating within seconds. And this is very fatal. The only symptoms that the person would experience is dizziness, followed by a collapse and unconsciousness, as you just said. And the individual has no time to react. So it happens within 4 minutes. The victim can only be saved with CPR if somebody's around. If nobody's around, well, it's fatal. Cardiac arrest can happen to anybody at any age, at any point in time. You could be driving, you could be parking your car, you could be eating, you could be sitting down home, you could be lying down sleeping. It could just happen at any point in time, just suddenly, and it could be very fatal. We're saying this is an electrical problem because the way that the heart functions is via electricity and via pumping system. All right. So you're seeing these people here doing CPR. So just to sum up that, cardiac arrest versus having a heart attack, the two of them is very much different. So a heart attack, as I told you, is a plumbing problem. A heart attack occurs when the blood flow to the heart is blocked. Cardiac arrest is an electrical problem, and cardiac arrest occurs when the heart malfunctions and stop beating unexpectedly. So cardiac arrest is when you're unconscious, and a heart attack, you're very much conscious and you're very much breathing and all of that. Everybody together with me so far?
Yep.
All right, great. So we're moving on. So some symptoms of having a heart attack varies between men and women. It's a little bit slightly different. Men have a lot of sweating, profuse sweating. Sometimes that's common with women as well. Pain in the chest, arms, the neck, or the jaw, especially on the left side. They have shortness of breath. They have heartburn or indigestion. So sometimes they feel very nauseated, but not often do men have vomiting. Women, on the other hand, feel very dizzy. They feel uncomfortable pain between shoulder blades. They have shortness of breath. Just like men, they have indigestion or gas pain. They have unexplained fatigue and sleep disturbance. Sometimes women feel so fatigued for days, they're feeling tired, and they complain that they're not feeling well. And they start cold sweating. Sometimes they're vomiting. When you check, it's a heart attack that they're actually having. They don't really get the pain in the chest or in the arms, the left side, or the neck or the jaw. Some women do, some don't, but commonly it's mostly men that have pain in the chest, in the arms, neck, or the jaw. How do we diagnose a heart attack? So when you come to the hospital, if suspected, the doctor may order one or more of the following tests. Treat a heart attack, you need to do diagnostic testing. So when they come, they will examine you. There are certain things that they're looking for. They will ask a lot of questions, like obtaining a family history, you know, if you have more past medical histories. So they want to know everything. So they will do a diagnostic test. Examination, sorry. They may do chest x-rays, and the purpose of doing the chest x-ray is to detect any changes or signs of heart failure. They may be collecting fluid as well, or you may have changes in the heart size may change as well. They do blood tests as well, and this is for certain conditions that raise the risk of having coronary artery disease. And these include certain tests like testing fats and cholesterol, and testing your sugar, testing protein levels. So the next one is ECG, which is very, very common. That actually records electrical signals as they travel through your heart. So this is important. And once you diagnose with having a heart attack, you have serial ECGs to see if you're having ischemic changes. And most oftentimes you have it every single day for 4 consecutive days or 5 days straight. This is a picture of somebody having an echocardiogram. So having the heart attack, and having confirmation, the doctors will most likely want to do an echocardiogram. And this is actually to see a picture of the heart. It's like an ultrasound with high frequency sound waves from a handheld wand. You're seeing the person placing it on your chest. And it actually provides pictures of the heart valves and the chambers to see and evaluate the pumping action of the heart. This is where the doctors will confirm if anything is wrong with the chambers in the heart, if the walls were thickened, if it's blocked, the ejection fraction, which is how much the heart pumps blood within a minute or so. So they check all of that. Sometimes they send people to do, this is an exercise stress test. And most oftentimes they make you walk on a treadmill or ride a stationary bike during an ECG. And this actually would check to see how much you can tolerate under stress. And they sometimes stimulate the heart by giving you medication to see how much you can tolerate it, if you can or you can't. And sometimes they have heart scans, like a CT scan of the heart. And this can help your doctors see calcium deposits in your arteries that can narrow the arteries. So if a substantial amount of calcium is discovered, coronary artery disease most likely will actually be detected based on having a heart attack. And lastly, this is through a coronary angiography. And this is to view blood flow through the heart. It's also called an angiogram. All right, we'll talk a little bit about this a little bit on. But this is actually, the doctor will inject a dye into the arteries of the heart through a long, thin, flexible tube. And this is threaded through an artery. Usually it passes through from the leg to the arteries of the heart. And they will actually determine after having a heart attack, which part of the heart is actually blocked. Because this is what a heart attack is, a blockage. So who are the persons at risk for a heart attack? Just like coronary artery disease, is basically the same risk factors. Persons with hypertension, persons with high cholesterol levels, diabetes, mental stress, age, inactivity and overweight persons, poor diet, poor nutrition, those persons who abuse substances like smoking, cigarettes, or marijuana, or consuming too much alcohol. Race, there's no race. As I told you before, it goes across the board. And family history and gender, obviously. Now we're seeing studies saying it affects women more than men. So we're going to talk a little bit of one of the risk factors. We're talking about 3 of the risk factors for having a heart attack. And we're going to talk about hypertension, which is blood pressure, force against the walls of the artery. And there are always 2 pressures expressed in blood pressure ranges, which is blood pressure. And the systolic pressure occurs when the heart pumps blood out from the ventricles into the veins. And the diastolic pressure is the resting pressure between beats for this next heart pumping action. So the systolic blood pressure is the number on top actually is measured and you see it recorded in a fraction. So you have a number on top and we have a number on the bottom. Do we have persons who have high blood pressure in the group?
Quite a few.
Right, so quite a few. So most of y'all would be actually checking your blood pressures and all of that. You'll be recording it and seeing you have a top number and a bottom number. So that's what the top number means. And this is what the bottom number means. So hypertension, according to the latest blood pressure guideline, is defined as about 130 to 140 or higher, or diastolic reading of 80 millimeters of mercury or higher. So we have the top and the bottom numbers. Some complications of having high blood pressure affects our arteries. It damages the smooth inner lining of the arteries, and this creates an irregular surface where plaque accumulates and blocks the arteries. It affects our heart. When arteries are actually clogged, the heart has to work harder to pump blood throughout the entire body. And this causes heart muscles to lose its strength and ability to pump the blood, which leads to a heart attack. It affects our brains. So when the arteries in the brains are blocked or torn, blood flow decreases. And this causes problems with our speech, movement, and vision. And high blood pressure actually causes a stroke, which is another part of cardiovascular disease. So it's very easy with having high blood pressure to actually be a risk factor of having other cardiovascular diseases under the umbrella term, right? So it can affect our kidneys. So some people with high blood pressure also have kidney disease. And this is because the kidney relies on tiny blood vessels to remove waste from the body. It affects our eyes as well. And it can cause retina damage where the pressure in the back of the eye increases. It causes blurred vision and it can damage the optic nerve and cause blindness. So how do we treat high blood pressure? So I want to hear from the group because I'm doing a lot of talking. I want to hear from the group how or what are some ways that you'll, if you say that there are few people that have high blood pressure, let me hear some of the ways that you actually treat your high blood pressure or you monitor or you maintain your high blood pressure. How do you do it? Let me hear.
So you can unmute your mic if you're speaking and we can hear you.
Exercise is one way. You're okay.
Could you repeat what you just said?
I said exercise is one way to strengthen your heart muscle.
Yes. Another person?
I believe a healthy diet or a balanced diet is a good way of preventing high blood pressure.
Definitely. I agree with you.
Taking your medication.
Yes, taking your medication. Anybody else?
Getting proper rest.
Yes. Sleep is important.
Not taking on stress.
Stress, definitely. Another person.
Having a happy
Cutting down on the
life.
salt intake.
Yes, definitely. Cutting down salt intake. Anybody else? Okay, so we're gonna move on. So one way in treating hypertension is actually checking your blood pressure. So sometimes when you go to the clinic, you would hear your doctor telling you, get a blood pressure machine, or the nurse is telling you, get a blood pressure machine. You need to check it. When you're checking it, you need to record it. And the purpose of actually having a little notebook or a little book and recording your blood pressures so that the doctors will actually see a trend within the last 3 months. They would know, okay, so within the last 3 months, the medication that you have been taking, maybe your medication has been working. They would know if and when and how and what medication to put you on now So having a trend tells them how to medicate you, how to change your medication. They would know if you're compliant with your diet. They would know if maybe it's just progressing, the disease is progressing and you're not doing better, so you need something stronger. So that's important. Making sure and keeping your clinic appointments, checking your doctors regularly, that's very important. Taking your medication. So medication compliance is very, very important with treating high blood pressure. Having an ideal weight and monitoring your weight, making sure you're not having weight gain. Exercising, somebody said exercise, eating proper diet, a balanced meal, not having these fatty, salty foods. Somebody already said, you know, watch your salt intake. Salt reduction is very important. Along with food, you have to have adequate amount of water. You have to not use too much of cigarettes. So, you know, telling people stop smoking is really difficult to stop smoking. I am not a smoker, but telling somebody stop smoking is really, really difficult. So you need to cut down and reduce the amount that you do, and eventually you will stop. Along with smoking is alcohol use. So you have to watch how much alcohol you, I'm not saying that you can't drink alcohol at all, but you know, in moderation, everything within moderation. And obviously keeping yourself updated, research, you know, networking, this what you're all doing together. This is awesome. This is really, really something wonderful. And, you know, educating yourself about your disease condition. This is really good. Somebody did mention about sleep and stress and all of that, and that is definitely important as well. So we're going to talk about another risk factor, which is diabetes, and this is the diabetic group. So I need somebody to tell me what they understand diabetes to mean. So we have a nice picture here with the pancreas and all of that. So I want to hear what your understanding of diabetes is.
Elevated sugar levels?
Yes.
It's where the pancreas isn't producing enough insulin to break down the sugars of the food that you intake.
Yes, definitely. I love that. It's a chronic disease. And it doesn't regulate the amount of sugar in the blood. It affects the way that the insulin regulates the sugar in the blood. When food is digested and absorbed, we have a lot of sugar in the blood. And this sugar is called glucose, which enters the bloodstream. And glucose is a source of energy for fuel that we need. We actually need glucose. We need energy. And our pancreas has islet of Langerhans cells that produces our own natural insulin. So when we have diabetes, so when our natural hormone is not producing enough, so it can't act on the food that we eat. So that's why we'd have a lot of blood sugar levels being high in the bloodstream, and it's going to affect us. So the role of the insulin actually is to remove glucose from the bloodstream into the muscle fat and other cells where it can be stored and used as fuel. But if this is not being produced, then we're going to feel tired, obviously, because we're not having enough fuel. So then we have to get insulin from outside. That insulin can act on the sugar levels. So then we have to get medication from the outside. We have to get insulin from the outside. So this is a major factor, a risk factor for having heart disease and obviously for having a heart attack. So the Framingham Heart Study states that the presence of diabetes increases the risk factor, the risk of heart disease twice in men and 3 times in women. It's really, really bad. So diabetes can lead to other serious problems, and these problems are known as diabetes complications. So the first one on the list is coronary heart disease, which leads to a heart attack. Cerebrovascular disease, which leads to a stroke, and retinopathy, which is a disease of the eye, which may cause blindness. Nephropathy is disease of the kidney and leads to kidney failure and frequent need for dialysis. And neuropathy is disease of the nerves, which leads to ulceration of the foot that might require amputation. So diabetes has a lot of complications that will affect us, just like high blood pressure, but we need to learn how to treat our diabetes. So let me hear some of the ways that we can, monitor our blood sugar levels, how we can, maintain a good range and, treat with our diabetes. The floor is open.
Come on, people, we are all here. We are all participating in this lecture, so we can all speak. we don't want the same people speaking over and over.
They're feeling shy. That's quite all right.
Miss Gracie? Miss Kojo?
By exercising regular, follow your diet. Follow your diet.
Definitely.
Stick to your medication. Always check the blood sugar level. Keep with your doctor's appointment. And proper rest.
Yes, and rest. Rest is so important.
For me, one of the main thing is eating in proportions. Not too much of carbs, or stay away from high sugar content food. Stay away from soft drinks and stuff, even though it may be very hard to do.
Yes, definitely. Anybody else? All right, so we're moving on. So one way in treating diabetes is always knowing your numbers. We need to always know our numbers. We need to always know how much my blood sugar is reading. And you should be checking it at least a few times during the day. At least 3 times. Nothing more than 3 times, unless it is that you're going hypoglycemic, where your sugar levels are a little bit on the low side, or you need to have insulin, or it's very, very high and you want to make sure that it's coming down. Because you have to stick yourself a couple of times, and it's really, really difficult, especially when you have to stick yourself. That is very painful, especially if you're not sticking yourself properly. If you're sticking yourself on the tip, remember we have nerve endings on the tip. You don't want to stick yourself too much on the tip because you'll damage your nerves. It's going to be painful. It's going to last for a few days. Well, so you stick yourself on the top of your finger, and that's going to pain you for a good couple of days. Well, so you want to always stick yourself, especially on the side of the finger where you don't have nerve endings, and that's going to heal up in the next hour or two, and you're not going to feel anything. So checking your blood sugar and writing it down, having a trend record, just like how you're managing and you're treating high blood pressure, and you check your blood pressure all the time. Checking your blood sugar actually helps your doctor to make adjustments to your medication. He will know, okay, so maybe Miss Vera or Natasha actually had cake today. We celebrate our birthday once a year. So we had cake today. That sent up our sugar, it rockets all the way up. So tomorrow, we're eating no cake because we celebrate our birthday once a year. So, we're not having cake every single day. We can't have birthday cake every day. So when you do things like that, the doctors will know, okay, maybe she had some real nice cassava and tomatoes or something. And that's why the sugar actually went up. She had nice butter cassava. So that actually causes sugar. So the doctors will know, all right, you're maintaining your diet, you're following what you're supposed to eat, you're actually taking your medication, being compliant. So if the sugar level is actually going up or going down, it's either 3 things. You're not eating right, you're not taking your medication, or your disease is progressing. So he would know how much to adjust your medication. Along with having diabetes, you need to monitor your blood pressure as well. And that's very important because these 2 diseases actually go hand in hand. Sometimes you have diabetes and you develop high blood pressure soon after. You have high blood pressure and you develop diabetes. Sometimes you stand alone with having either one of the conditions, but most often times you see people with high blood pressure and diabetes. So it goes hand in hand. you always go see your doctor. You keep your doctor's appointment. Try not to miss your doctor's appointment, because it's very important to get your medication, to have your talks with your doctors, have your talks with your nurses. So you try to visit your doctor regularly. If you like going visiting your private doctors, you do that as well. You be compliant with your medication. You take your medication when you have to take it. You don't take some and leave out some. You take your medication as prescribed. Take other people's medication. Important for treating diabetes is actually monitoring your eye and how the eye works, and checking your eyes constantly every 2 years. Some people do it every year. Some people do it every 2 years. You check your eyes and how well it's functioning. Because if your blood sugar is high or your blood pressure is high, it affects the optic nerve and it causes the pressure in the eye to go up, and it can lead to blindness. So this is very important. You see a lot of diabetic patients, you all would know because you're all in the diabetic group, and a lot of persons have to go see the eye doctor. A lot of persons are actually in the eye clinics. So this is a very important thing. So a lot of diabetic patients develop cataracts and they have pterygiums, and we have a lot of people that can't have eye surgeries because the pressure in the eye is too high, because the blood pressure is too high, the blood sugar is too high, so you're at risk of bleeding if the doctor go to operate. So, you know, eye health is important, and you need to monitor your eye and how well it functions. So visit your eye doctor regularly. Having a good weight, that's important, an ideal weight. You need to check your weight. Make sure you don't have a body mass index more than 25 or above. So, you know, you need to have an ideal weight. With weight is about exercise. Diabetes actually, it gets improved with exercise. Sometimes we feel tired and we can't exercise, but you know, you consult your doctor. There are certain things that you can do. You can walk in the garage. You don't have to do rigorous exercise. You know, you don't have to go on the treadmill. You don't have to do all those things. You could go on the treadmill, but walk slowly. You could walk in your yard. You could walk from the gate to the yard, from the door to the gate. You could walk on the pavement. If there's a park or savanna where you live, you walk. That's important. If you can jump rope, you jump rope, but that's a little bit strenuous as well. So exercise is good. Walking on the spot, jogging, all of that, that's really good. So you have to watch your substance abuse as well. So smoking and drinking, it goes together. That's important. So you want to limit the amount of alcohol. So I say it's do it in moderation. And you don't want to have too much of that to your system, because it affects the way that, you know, your blood sugar is going to work. It's going to send your blood sugar high up, and we don't want that happening. Education is important, and educating yourself and networking, and this is what you're doing. I can't say enough. It's really, really good. I am so happy to hear that there's a group like this and you're all doing things like this. We don't hear about these things. You know, in hospital, we don't hear about these things, and this is really, really good. Stress. Somebody spoke about stress, and stress is so important. It's very, very important with maintaining your blood sugar levels, even your high blood pressure. Drinking a lot of water and sleep and resting and all of that is very important. So the other risk factor that we're going to talk about, the last one, is about stress. So stress is your body's reaction to a challenge or a demand. And most of us have come to think that stress is bad for us, but it's really part of our fundamental survival. It's part of our body's makeup. And medically, stress is the body's response to physical, mental, or emotional pressure. And stress can actually cause chemical changes in your body that can raise blood pressure. It raises your heart rate and blood sugar levels. And it may also lead to feeling frustrated, or, you know, being anxious or angry, or sometimes getting depressed. So maintaining your stress is very, very important. Sometimes there's this thing called the fight or flight system in the body, and it's a biological stress response. So let's say, for instance, you have a really vicious dog barking at you. Is either you do one or two things: you stand up and let the dog bite you, or you start running. And the faster you start running, you know, you're gonna get that energy. So that's one of the good things about stress. It actually allows, or it activates the fight or flight system in the body, and it causes you to respond. So that's the challenge there. That's the challenge there. So can some people tell me what are some of our stressors in life? What are some of the things that causes stress? Anybody?
Spouses.
Spouses. Good stress or bad stress?
I'm just kidding. I'm just kidding.
Financial challenges. Financial challenges.
Yes, financial challenges.
Miss Hillary said work.
Work stress, yes, definitely.
COVID-19.
Yes, COVID-19 is actually one of the significant events in our lives that has changed so much of how we do things. We no longer have the normal way of doing things. We have a new normal that actually, you know, is something that we just have to deal with. We just have to live with it. We just have to move on. But it's creating so much stress for us, so much anxiety.
A lot of kids going through that with education as well.
Definitely. This is a new way of adjusting to the way that education is going to be. Schooling is going to be so much different. Any more?
Relationship problems.
Diagnose.
Yes. Relationship problems. So we can have getting married could be stress. Being married could be stress. You know, relationship problems is stress. Somebody was saying something.
I was saying worries.
Worries. What kind of worries, Gail?
Okay, well, like children.
Children worries. Family worries.
Family.
Yes. We have stresses with all kinds of relationship with not only our spouses, but with our children, with our in-laws, with our siblings. We have lots of stress with relationships. Yes. So emotional problems, you know, being anxious, being always angry, having grief, you know, feeling guilty, having a low self-esteem. So that could be some stresses in life, having to deal with of a loved one. A lot of people have stress because of that, and it's really difficult and hard sometimes for people to move on because of the death of a loved one.
Yeah.
Somebody said money worries. So definitely we have people that owe us money. We have people who hunting down money. We have people who can't catch money. We have people who making too much money and don't know what to do with it. So that's a stress by itself.
Oh, bring that one on.
So we have stress at work. Somebody rightfully said that. Yes, all of us have stress at work. Sometimes we have stress because we lost our jobs. It's really difficult because of the pandemic. It's really hard on a lot of people that can't find jobs. So, you know, stress of job is difficult. It's difficult to deal with. Some people at work, one of our problems is communication problems. Communication problem is a real problem. It's everybody's problem. It's an everyday problem. Communication problem is people's biggest problems. Time management is people's biggest problem as well. Sometimes we have stress because of our house, you know, moving to a new home could be a problem, or the house breaking down and I don't have no money to fix it. All of that can be a problem. Or we have family fighting for our homes, fighting for land, this sort of thing. That's stress. We have problems with cars. The car can't fix. We don't have the money to fix the car. So we had to travel. We live in so far. You know, it's really difficult. We have so much stresses. This person that said we have worries with children. We have worries with everybody, but this need to hit home. Elderly people have a lot of stress because we need people to care for us as well. Sometimes the younger ones don't want to care. A lot of people you will see come in clinics and this auntie or this uncle coming by themselves and they could barely walk. They hire a taxi to come clinic. And when you ask them, so where your children, where your family? They have no family, you know how children are. You know, you hear them say that all the time. You feel so sorry for them. You feel heartbroken, but that's a stress as it is by itself. And this person who spoke about children having stress in school, you know, when you think about it, you actually have a stressor in life at every age of your life. So there's no one particular time for you to have stress. As a child, children now having stress because we have on the rise suicide with, you know, suicide attempts with young children. You see it more around SEA time. So teenagers have their own stressors with relationship and they shouldn't be having relationship problems at that time, but they take it as stressors, you know, and married people, young adults, middle-aged people, they have their own stressors, you know, losing a job, that could be a stress in your life, you know, wanting to have your home, can't finish your home, not having money, that's a problem, you know, owing people, owing the bank, you know, you have loans to pay, that's a stress as it is. And when we get older, that's a different kind of stress altogether. I haven't reached theirs yet. But when I get there, I hope I could deal with that when I get there.
You learn already.
We also have chronic illness or injury. So some people, you know, because of illness, that's a stress as it is, you know, having cancer, having chronic diseases, you know, just being sick, that's a stress on its own. And that's really difficult when you have to deal with sickness. And obviously this new online schooling that we have to deal with, that's a stress by itself. Stress can affect your health, and routine stress may be the hardest to notice at first. And over time, continuous strain on your body from routine stress may contribute to serious health problems such as heart disease, high blood pressure, diabetes, or other illnesses, as well as mental disorders like depression or anxiety. So stress actually, if you have cancer or something like that, stress actually accelerates cancer progression by, you know, inhibiting protective immune responses. So it enhances harmful immune responses and increases the growth of cancer cells, enabling tumors to grow faster and metastasize and just, you know, move to a different organ. So stress can produce long-term increases in inflammation and oxidative damage, which may be ways that chronic stress can affect other medical conditions. So it can, and it seriously has health problems. So how do we treat stress? Let me hear of all the people that tell me about all the stress. I want to hear about this woman that tell me she has worries and children that gives she worries. Let me hear how you just deal with your stress. I'm so curious. Sorry, I don't know your name.
Miss Cujo.
Miss Cujo? All right. I want to hear how Miss Cujo does deal with your worries.
You have to unmute your mic, Miss Cujo.
Is Miss Cujo there?
Unmute your mic.
Miss Hillary said listening to some soothing music.
Yes, definitely. I totally agree.
Right. Well, develop a positive attitude in thinking.
Yes.
Yeah.
Definitely. Another way.
My way of dealing with stress is to lock off.
So you
lock off.
Uh-huh.
When I say lock off, they're talking and they make a noise and I go through one eyes and they come through the next eyes. Nothing stays inside.
So how are you actually locking off? Because I want to learn how to do that.
I just do that very well. My wife and kids will be speaking to me and say, Daddy, you're not hearing me. And exactly, I'm not hearing them.
Because you lock them off.
I lock them off.
Right.
Sarah
can attest to
Sarah
that.
can testify to that.
I can attest to that.
Okay.
I would like to know how to lock off.
Me too. I want to learn how to do that at work.
Because I have a problem. I have a problem of doing that. Sometimes I will sleep and wake up and just keep on thinking about the problems and I can't go back to sleep.
So you're overthinking. So then you would be somebody who is very emotional and gets easily hurt. So then you have to.
In a case like that, you have to get other things to preoccupy your mind. You look at a movie, you listen to some music, you read a book. You just get something to just take your mind off the problem at this particular point in time, just to give you a break and take a breather and come back.
So I really like that concept that you're talking about, because
and then you get a new perspective on it when you come back.
Right. So I have that same concept in my head about how to deal with stress. And it's all about me and you knowing you and understanding you. And dealing with stress, it's not something that everybody could deal with. Not everybody knows how to deal with stress. You know, it's really, really difficult. And it's very, very hard at times. And I really want you all to really find a way as to how to deal with stress. And you are right and you are correct in what you're saying, that you know you need to find the things that helps you. And that's important. That's very, very important. So let's move on to my concept. And once you understand you and understand about you, you have to know what are the things that makes you contented. So if you're contented, you actually, you know, thankful for a lot of things. You have to know you. You have to understand what emotional intelligence is. And that's actually simply understanding, you know, yourself and the things around you, and understanding your issues and finding a solution to move forward, trying to find out and understand others and knowing how to deal with them. So you need to learn how to do this as well. When I first took up the position as head nurse, I couldn't sleep at all. I just would be just like this person who said that they go to sleep and as soon as they get up, they're thinking about it nonstop. I was like that, and I had to stop myself. I literally had to stop myself, and I had to understand, listen, this is not working for me. I need to sleep. I need to get my sleep, but I need to stop thinking about these problems, because Rome wasn't built in a day, you know, but I have to take my time and I have to work through my problems. I have to deal with my problems, and you have to find a way of dealing with it. So this jug of water here actually represents me. And everyday life, we have stressors. We have things that challenges us. We have things that gives us worries. We have things that allows us to worry. And inside of this jug is filled with water, and that water is considered to be our stress. What we do with this jug of water is very important. So we're going to get some glasses. We're going to find a whole bunch of glasses. And inside of these glasses actually represents the things that this nice gentleman was talking about. Find things, find ways to reduce your stress levels. And all the things that everybody discussed, I totally agree with you. For instance, if you are spiritual and you look to God for that comfort, for that solace, you look to God for that support. If you had a stressful situation before, the thing that worked the most for you, that's what you're going to use each and every time you have a stress. So some people say, I leave it in the hands of God. It's only God, you know, God alone can help me go over that mountain. God alone can help me see through all my stress, all my worries. So some people look to church. So if we take this glass and we start pouring our stress into church, into God, into, affiliation with God, into doing service for God, then it means that we get rid of some stress. But it doesn't mean that the stress goes away, because it's everyday life. Stress gonna come back, so the jug gonna full up again. So what we're gonna do again? We're gonna look for another way. If you like gardening, you put your stress into that. You go plant, you do flowering. A lot of women love flowers. I, for nothing, I love flowers and I can plant flowers. I have a whole set of pots with a whole set of sticks. And for nothing, these things wouldn't grow, but I love flowers. So if you have a good hand for flowering and stuff like that, that actually reduces your stress levels by doing things that you enjoy. For instance, some people like yoga and meditating and exercising, and that works really good for them. And the more that you pour your stress into these glasses, into doing things, your stress levels is always going to build up. It's always going to build up. Somebody said music. Somebody said cooking. If you like cooking and feeding people and love to see people eat, you can do that. You can go shopping, because with this COVID thing, things open up now, but we have money to shop.
Oh, I don't know about that one.
Yeah. A lot of women love shopping. Also, some people like reading a really good novel. That actually works for them. If you like nature like me, so where I live near the Canopia River. So I can sit on the bank and I could overlook the river. If you like going places outside, we can't hike, we can't do certain things, but things are opening up pretty soon. We'd get back outside in nature. You go outside, you don't need nothing. You just throw a chair outside, you put up a pot outside, and you have a nice little cook. And you enjoy yourself outside with your family. You go to the beach. Right now, we can't go to the beach, so that's out of the question. But eventually, we'll get there. And as soon as the beach opens, you see everybody flocking to the beach. You have hobbies. You like sewing. You like scrapbooking. You like different things. You find a way. You have family. Some people look for support from family. Some people look to run away from family. Some people lock off family. So family is the major stress. So we try to get far away from family, but there are some people that are really close-knit with their family. And, that's a form of, getting rid of your stress. And lastly, a lot of people like baking. So if you're like me and you have a lot of glasses, you start pouring out your stress in different things. And this is a really nice concept. And just like this gentleman, I was thinking along the same line with him, finding things that makes you feel good, finding things to do that helps relieve your stress. So in other words, you're fixing you. And that's what it's all about. It's about fixing you. And when you fix you and you reduce your stress levels, you reduce your blood pressure levels, you reduce your sugar levels, you feel better about yourself, you feel happier, your emotions change. So you're not down, you're not depressed, you're not anxious, you actually get happier. So that's important. So how do you treat a heart attack?
Before you move on from the stress, if I may.
Yes,
Hello?
sure.
Okay. You want to treat it at source and not take on things that don't really matter in a large way.
Yes.
Some things are not as important as they might seem initially.
Yes.
And that is, so you keep your jug empty as low as possible.
As much as possible. You keep that jug as least amount of water as possible. You keep that jug as empty.
I sum it up by saying, don't sweat the small stuff.
Yes, definitely. So, sometimes you try to find that contentment within yourself and you simplify your life, because one thing COVID is teaching us is that we need to simplify our life. And we need to learn how to live with the things that we don't really need. And this is the one good thing about COVID. It's teaching us that we don't need all these things. We need to simplify our life and deal with the things that matters the most to us, which is family, which is loving each other, which is making you better and, just living a good life. And that's important. That's very important. Yes. So thank you so much for that, addition. I really appreciate it. So the type of heart attack you experience determines the treatment that your doctors will actually recommend. And remember, we were talking about diagnostic testing, and angioplasty is actually one of the diagnostic tests and that you would do. And an angioplasty is actually, you know, viewing how the blood flow through your heart. And as I mentioned before, the doctor will actually inject a special dye into your coronary arteries. So they mostly go into the groin area, and they would pass a long, thin, flexible tube. It's very, very small. And that's threaded into your artery. And it, as I said, it usually goes into the leg in the groin area, and it goes all the way into the arteries of the heart. So you would actually see the tube going in there. And that test is actually called percutaneous coronary intervention. It's a PCI. So most people, has anybody ever heard about having a PCI or did a PCI before?
I've had 2.
Right. So it's like stenting. So they did leave a stent.
Both times they going through the wrist. You know,
Right. So sometimes they go through the wrist if it's viable, and if they can't, then they go through the groin area. So stenting is actually a way that the cardiologist will put a small metal tube like a stent. So the picture in the middle is actually showing you the stent. So when that tube goes inside the artery, it actually is to keep it open. And this tends to happen during the PCI, when you're doing a PCI. Another treatment is through medication. So various drugs can be used to treat heart attack, and most oftentimes it's thrombolytic medicines or anticoagulants, things like aspirin and Plavix or Brilinta or stuff like that. And this actually works by dissolving blood clots. Remember, we said a heart attack is when a blood clot blocks the arteries and prevents blood flow. So if you thin the blood and prevent the blood from clotting, then you would have the blood thin enough so that it can flow. And the only thing about blood clotting, you have to look at bleeding. Blood clotting medication, anticoagulants, you have to look for bleeding. There are also cholesterol modifying medications that actually decreases the amount of cholesterol in the blood, especially, you know, the bad cholesterol, which is the LDL. And these drugs actually decrease the primary materials that deposit on the coronary arteries. So most of you all would be taking cholesterol tablets. If you're diabetic, the doctors will put you on something because we don't want cholesterol building up. So you would use things like Crestor, Lipitor, Simlo, Simvastatin. They would also give you things like beta blockers, like atenolol. And what that actually does is, you know, it slows down the heart rate and it decreases the blood pressure, which decreases the heart's demand for oxygen. So a beta blocker, when combined with aspirin or anything like that, it reduces the risk of future heart attacks. Also this, pardon me?
A question, please.
Sure.
Is there any drug that reduces the already existing buildup of calcium?
I don't think in Trinidad we have that. We have that in the States and stuff, but in Trinidad we don't really have that drug. We don't give our patients those drugs. We actually tell them, watch what you're eating. So diet plays a huge part in you know, calcium or cholesterol deposits in the arteries. So not really drugs. The drugs actually doing different things, you know, where cholesterol buildup is concerned.
So you can prevent further buildup, but you can't get rid of it.
You can't remove it with medication, no. You would have to do the angioplasty with the stenting or the PCI to actually remove the plaque from within the arteries. So another treatment, no problem. Another medication that's very common is ACE inhibitors. So these are drugs that decrease blood pressure and helps prevent the progression of coronary artery disease, like things like enalapril or your pressure medication. So that's most common. The other picture on the right, you will see coronary artery bypass. Has anybody in this group had a bypass before?
Nope.
No, we just had stenting. So coronary artery bypass is where the cardiologist would actually create a graft to bypass the blocked coronary artery using a blood vessel from another part of the body, usually it's from the leg. So remember we said having a heart attack is like the plumbing part of the heart that's affected. So think about it. You have a tap at home that's not working. It's real old and rusty, so the water is not flowing from it, which is actually what's happening with our arteries because of the plaque buildup. So the water is not coming out. So that pumping system is not working. So you get a plumber, and what the plumber going to do is close off that valve. And what we're going to do is put another elbow or another valve and create another pipe so that the water could flow better. So that's actually what the coronary artery bypass does, create another valve and create another way for the blood to flow. But it doesn't mean that that blockage is gone or is removed or taken away. The blockage is still there. It's just that we actually removing a good viable artery and we're running it in another way so that it could go around the heart and supply the heart muscles with blood supply. So everybody okay with that? We on the same page?
Yep.
Yes. So we're moving on. So some complications are often related to the damage already done to the heart during a heart attack, which can actually lead to abnormal heart rhythm, which is arrhythmias. And arrhythmias actually things like atrial fibrillation. Anybody in this group has atrial fibrillation?
I'm not sure.
Not sure. So atrial fibrillation people are normally on warfarin and stuff like that. Okay, so this is electrical short circuits that can develop, resulting in abnormal heart rhythm, some of which can be serious and may lead to death. So abnormal heart rhythm can lead to a stroke, and so you would have medication that will thin your blood to prevent that from happening. So if your heart has been damaged during a heart attack, if it's not being taken care of, if you're not changing your lifestyle and all of that, you can lead to having arrhythmias, which is abnormal heart rhythms. Also, it can lead to having heart failure. So a heart attack might damage so much of your heart tissue that the remaining heart tissue can't pump blood out of your heart.
Is that the one that's treated with the pacemaker?
No, that's not the one with the pacemaker. So the one with the pacemaker is an abnormal heart rhythm. It's just slower. So an abnormal heart rhythm could be fast or it could be slow. So you have bradycardia, and bradycardia is when you have a slow heart rate. So you would require a pacemaker if it is that your permanent pacemaker, the pacemaker that you were born with, your SA node, the sinoatrial node, if that node itself is not functional. So that's our natural pacemaker that we were born with. So if it means that that is not functional, then the electrical currents that starts from the top of the heart and runs all the way down to the bottom, if that's not sending out enough electrical current, then it means that you're going to have a short circuit, and it means that you're going to have a slower heart rate. And definitely you would have to go and have an incision of a permanent pacemaker. So on the opposite side of that, if your heart rate is beating fast, and you develop tachycardia, which is a very fast heartbeat, then it means that you need to have medication to slow down your heart rate, or you need to have installation or incision of a device, a defibrillator device. So we have that in Trinidad. We do that at Mount Hope. but it's very common these days. So we have a lot of patients that come to our cardiac unit at San Fernando General that require permanent pacemakers inserted and defibrillators that we send our patients to mount up to have done. So it's very common, and that's a really nice comment that you made, so that we could, you know, discuss that as well, because this is what happens, you know, after I have a heart attack and the damage is done. These are some of the complications that can happen to you. So because the heart attack damages so much of your heart tissue, the remaining heart muscle can't pump enough blood out of your heart. And heart failure can be temporary or it can be chronic, resulting from the extensive permanent damage to your heart. When you have heart failure, you actually have congestion. This is a topic to discuss at another time, but it's very common at San Fernando General, where we have a lot of patients that come in with congestive cardiac failure. And this happens when you have a lot of accumulation of fluid. So you would see persons coming to your clinic, your chronic disease clinic, and they have swollen feet, they have swelling in the arms and the legs and the face. There are other conditions that causes swollen feet and stuff like renal impairment and all of that. So you have the tummy swelling because we accumulating fluid and we having that congestion of fluid around the heart and the lung. And these sort of people develop this after having a heart attack because the damage has been so much. In addition, these are the type of patients that have diuretic medication, like Lasix, which is water tablets that some people call. So you'd have to have medication like that. And these type of people, they really have a lot of difficulty with breathing because of the congestion, because of that accumulation of fluid. So you would find yourself, you can't lie down properly on a pillow. You have to sit down and sleep like Big Bird, which is really difficult. So you have breathing problems constantly. And then when you don't watch your diet, so this is important. You have to watch your salt intake. So somebody had mentioned that before, you know, with treatment of hypertension, watching your salt intake, having salt reduction. So this is important because heart failure, when that happens, has a lot to do with salt, because when you have an intake of salt, water always follows salt. So let's say you sprinkle or a little bit of salt falls on the counter, you know, when you're going to cook or whatever, and you didn't wipe it off the counter and you come back, you would notice that that salt actually turned into water, right? This is actually what happens when we eat food that have too much of salt after having a heart attack, or being high, you know, having high blood pressure or having congestive cardiac failure. This food that has salt, when we actually eat it, water starts accumulating. So this is how we start having addition to our congestion, and we start gathering fluid. And then the doctors have to give us Lasix, and then we have to be taking Lasix constantly and, you know, passing lots and lots of urine because it's a diuretic that makes us get rid of the extra fluid. And then it pushes us into renal impairment because it affects our kidneys. So a lot of the medication that we use affects different organs in our bodies. So things like exercising and changing your diet, and because these are chronic diseases, lifestyle diseases that are preventable diseases. So why rely only on medication? Because medication causes damage to different organs. So using a lot of high blood pressure tablets actually affects the way that the liver functions. It affects the way the kidney functions, which is why every time you go to the health center and you visit your doctor, every 3 months or so, you have to do blood tests to check your renal function, check your, you know, your liver function, check your lipid profile. So these are important things. If we change our lifestyle and we change, you know, our diet, we exercise, these sort of things, this is what's going to prevent our complication. Also, can cause a sudden cardiac arrest. Remember, we spoke about the cardiac arrest being an electrical problem. And without warning, your heart could just stop due to electrical disturbances because of the arrhythmias, so which is a short circuit. So that could happen because the heart rhythm could be too fast or too slow. And in a split second like that, the heart just stopped beating. And it could be fatal. It can cause death without immediate treatment. And the bad thing about having cardiac arrest, it happens when we are asleep. It happens, you know, when we're doing anything. It could just happen and you can't tell anybody. You just start to feel sick. And with that, you collapse. And if the people are wrong, you don't know how to do CPR, well, you're dead. You know, that's just the reality of it. And it's really, really sad. And, you know, we have to take better care of ourselves so that we don't reach these type of complications, because it's really, really bad. It goes downhill from here on. The moment you have a heart attack, you have to start taking care of yourself, or you take care of yourself before you reach that point, because we don't want to have a heart attack. Understood?
Thank you.
Yes. So how do we prevent a heart attack? So just like when we were talking, preventing and treating our risk factors, you have to treat your risk factors. So you have to do hypertension management, change your lifestyle, change the way that you do things. You know, having your salt reduction program at home. You know, some people, when they have high blood pressure, say it's really difficult to not eat food with salt. But after 7 days, your taste buds get so used to not eating salt that the moment you start eating something, or you go by somebody and you eat a little bit of food that they put a little bit of salt, you know, the little extra salt, your taste buds will pick up on it and you can't eat that food because you find it tasting too salty. So, you know, it's things that we can do. It's feasible. We can do it. It's just difficult, and you just need to start. It all starts with you. Stress management, nutrition, exercise, you know, getting active, that's very important. And you could do these things: stress management, diet, exercise, adequate sleep and rest. All these things is important. These are natural ways of preventing it rather than just relying on medication, you know. And medication compliance and managing your substance abuse, that's important as well. But regular visits with your doctor and having diagnostic testing performed, that actually helps in preventing it. So monitor for warning signs, and this is important. And when you see your warning signs, you act on it. You're having shortness of breath, you know, you're not feeling well, you're having the pain on the left side. You know, you don't sit down and you don't think it's gas. You're having this chest pain, but you're thinking it's gas, and we go and drink some orange peel tea, or we make some ginger tea, and we try to belch all the gas out. But really and truly, it's not gas, it's actually you having a heart attack. So, you know, you look for your warning signs and you act and you educate yourself, educate yourself, educate yourself. I can't say that enough, because health promotion and health literacy is so important with managing any disease. So what do you do? Can anybody tell me, what do you do if you're with somebody and you think that they're having a heart attack? Does anybody know?
Call the ambulance.
Yes. What's your name?
Take 2 aspirin and call 911.
Okay, we'll call 911, no problem. Anybody else?
Someone say you need to take cough.
Yes, definitely. So you call for help. You definitely need to call for help. Now, it's not possible to stop a heart attack if somebody is already in the process of having it. Because a heart attack generally causes chest pain for more than 15 minutes, but it could also have symptoms. It can also have no symptoms at all. But many people who experience a heart attack have warning signs, like hours, days, or weeks in advance. It's not like a cardiac arrest. So anyone who suspects that somebody is having a heart attack definitely should call for help straight away. So you can't ignore that. But you need to remember, if you're calling the neighbor for help, you're calling emergency medical services for help, you can call the hospital, you can do those things, but don't try to sit in your car and drive to the hospital. That's something that a lot of patients do because they don't have nobody to bring them to the hospital. So a lot of people, my dad, he lives in the States and he had a heart attack and he did that. He literally sat in his car and he drove to the ER. And when he got there, he got treated. And this is something that doctors tell patients don't do, because when you're having a heart attack, sometimes you could simply have a cardiac arrest and get an accident and cause other people to get an accident. So, you know, you have to be so careful. So this is something that they tell you, try to avoid sitting in your car and driving. Another thing is loose and tight clothing. So during a heart attack, people experience pains in the jaw, nausea, tightness, squeezing in the chest, you know, shortness of breath. So loosening tight clothing, such as, you know, a tie or a belt or the pants, the shirt, you could do that. So looser clothes actually makes it easier for when the EMS actually comes to assess the person. It's already loose, but it also helps the person to breathe better as well. Somebody said coughing, make the person cough, and it's a really brilliant idea. Coughing, some people say that it will help to stop a heart attack by keeping the blood flowing to get the oxygen going to the heart muscles. And I totally agree. And you know, when you cough, you literally give a forceful cough, you can get oxygen in and getting that oxygen to your heart muscles, because at that point in time, that's when you know that person is not getting any oxygen supplied to that part of the heart because they have a blockage. All right. Opening the doors, if the person is indoors, some people feel so claustrophobic and, you know, they start panicking and they start getting, you know, anxious. You can open the door and that makes it so much easier. If it is that you're home alone and you call for help, then you open the door and you find yourself in a sitting position, in a restful, comfortable position until the ambulance arrives, if you're by yourself. And resting actually relieves pressure on the heart as it tries to pump blood around your body. And that's important. And this could involve, you know, you sitting down or you're lying down, depending on whichever feels more restful for you. Additionally, somebody spoke about aspirin. Now, you will take aspirin. You can't take the aspirin unless you're allergic to aspirin. And if you have been told by your doctors and you have aspirin, you can do that. When you call the ambulance service, you can tell them that you have aspirin and you're going to take the aspirin. They will let you know, yeah, go ahead and you take your aspirin. You can take nitroglycerin. This is simply called GTN. For most persons, who having chest pains, this is angina, doctors would normally put you on things like GTN, so you can put it. So remember, I did mention a little while ago that some people, a heart attack can generally cause chest pain for more than 15 minutes. So that's what you're looking at, the 15 minutes window. So you take one GTN and you place it under your tongue, you wait the next 5 minutes. If it didn't relieve, you have another one to take, and then you have another one to take. So you have up to 3 to take within a 15-minute period. If you get no relief, that's when you're supposed to find yourself to the hospital. Okay, so that's how you know, hey, something is wrong, probably having a heart attack. So once you've been placed on nitroglycerin by the doctor, that's how you know I can take my GTN. That's the time frame that I take it. If it's not being relieved, then I definitely find myself to the hospital. And you begin CPR if the person is unconscious. If the patient is not breathing and all of that, they say if the patient is unconscious, you tell the dispatcher for the EMS and you tell them that the person is not breathing. They may advise you to begin CPR, which is cardiopulmonary resuscitation. If you haven't received any sort of CPR training, it's recommended that you skip the mouth-to-mouth rescue breathing and you perform only chest compressions. And you can fold your hand one on top of the other and put it in the middle of the chest. You don't need to know at that point in time, you don't need to know the actual points because you haven't been trained in CPR, but you do your compressions. You're pressing down forcefully for about 100 times per minute. And the person would normally stay on the line and they can guide you accordingly. All right. But these are some ways that we can, tell us somebody is having a heart attack, these are some things that we can do at home. So in conclusion, we realize that heart disease is one of the leading causes of death in Trinidad and Tobago. And factors leading to heart disease can be prevented with lifestyle modifications, just changing the way that we do things. In every disease condition, lifestyle modification is a major player in improving and preventing the progression of that disease. And yes, research shows that lifestyle changes can prevent heart disease because it's a preventable disease. An important part of keeping your heart healthy is by having access to up-to-date information. So, you know, networking, this what you're doing, I can't say it enough. This is really awesome. This is great. You know, having internet access, reading, you know, researching, this is very important. So keeping your heart healthy, keeping yourself accessible to information, that's so important. And use of this presentation to arm yourself with the knowledge to assess your risk and take action to prevent cardiovascular disease. That's so important. So I hope that you all use what was said and you shared with other people. And I hope that it was very helpful. And I just want to say thank you because this was nice. This was something different for me. I'm normally speaking to patients face to face. And now, if you all have any questions, we can discuss our questions. If you all have questions.
Okay, so the floor is now open for anyone who has questions. You can just unmute your mic and ask Ms.
Ravello.
Ravello the questions.
Yes.
Hi, Ms. Ravello. This is Farah here.
Hi.
You spoke about tachycardia, right? For a person who have been monitoring their blood pulses and their different beats and stuff, and they notice that they are getting high readings, like let's say 113 or 108, you know, along the high range, what's the process that someone should go to find out if they are indeed do have tachycardia per se?
Okay, so with women, sometimes we actually have our heart rates going up to maybe 108, 110. That's quite normal. If you're exercising and stuff, that's quite normal. If you see it ranging, so normal heart rate is between, let's say 60 to 80, that's normal heart rate. If it's a little higher than that, it's possibly, you know, because of exercise, or possibly sometimes medication can cause it to happen, or stress or anxiety that can cause it to happen as well. Alongside having a high heart rate, if you see that it's going past 120, so it's crossed 110, so it's going up 115, 118, 120, let's say 122, you're going to start feeling restless because that's normal. That's not normal heart rate. You're going to start having palpitations because the heart is beating faster. You're going to feel differently. When you start feeling differently, obviously you're going to go to the hospital. You're going to see a doctor because your heart is racing. They would probably put you on beta blockers and help reduce the heart rate. So they'll watch it and see medication will work first. If it's not working and it's progressing, it means that something is wrong and you have developed arrhythmias. So then they will start treating you for arrhythmias. So then you will get medication for arrhythmias. Then you have surgical interventions, which is the insertion of having a CRT device, which is a portable defibrillator. But you have a lot of diagnostic testing that has to be done before you reach that point. So if you know your heart rate is going up, every time you go to the health center, you mention it to them. They have ECG machines, and they're supposed to be actually doing an ECG if you're feeling a little bit different, because you're going to feel dizzy, you're going to feel uneasy, you're going to feel restless, you're going to have a little shortness of breath if your heart rate is going up more than normal. So that's when you have a red flag and you bring it to the attention to your doctor or your nurse so that they can do, you know, a little diagnostic testing from there on. Just don't sit down with it. That's it.
Thank you.
You're welcome.
when a person gets an heart attack, that damages the heart, right?
Yes.
Okay. The only way to repair that is to do a bypass surgery.
No.
No. Because the reason why I asked that question, because I have a friend who works with me, tell me that his dad has had 9 heart attacks already and he's still alive.
How many?
Wow.
How
9.
many open heart surgeries did he have?
None.
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 Okay. So sometimes there are different types of heart attacks. So you have a STEMI and with ischemic changes, and you have the NSTEMI. And sometimes the heart attack is not severe. Or after you have the heart attack, you would normally see a doctor sending you to have an echocardiogram. When you have the echocardiogram done, the doctors will determine which part of the heart is blocked. And from there on, then they will tell you where to go forward. Not all the time they will tell you that you need to have surgical interventions, whether it's a PCI or stenting. Only if you have a single artery blocked or a double artery block or triple vessel disease, that would require coronary artery bypass. But sometimes you would have to be optimized. So sometimes the patients can't have surgery because of their conditions, and the doctors would use medication to have optimization. So that person definitely can't do anything. They would just be having heart attack after heart attack. So it's based on the person's condition, and they would have to, be checked out and do their diagnostic testing with the cardiologist, and they would determine. So I think that somebody had 9 heart attacks and he didn't have a bypass.
I think it's probably because of his age. He's 80-something years old.
Okay, so maybe he is not a good candidate for having open heart surgery.
Probably.
Yeah, probably.
But once the heart is damaged, it remains damaged. It will always show up on our ECG, right?
If you're having an active MI, you would have changes with your ECG rhythm. So doctors look for ischemic changes on your ECG. And if you have an active heart attack, that would show up. If you had a heart attack, let's say 4 years ago, and you do an ECG today, it's not going to show up unless you're having an active heart attack.
Okay. Cool.
So is it possible to have or had a heart attack in the past and not know that you had a heart attack?
Yes, it's possible. Remember, some people have symptoms and some people don't have symptoms. And it could be a mild heart attack, but a heart attack is a heart attack. Some people have massive heart attacks. You hear doctors say massive heart attacks or mild heart attack. But it's according to the symptoms that you're having as well. And definitely those are the things you would have to do your ECGs and stuff, and the doctors will determine, that aspect.
Ms. Kojo, well, what you are saying is true, because with my mom, right now her feet are swollen. And it had at one point in time when we took her to the hospital, they did the ECG and they told us that she had a heart attack, and we didn't even know that. We didn't even know because it showed up and
And she had no symptoms.
No symptoms.
So
but right
that
now,
happen.
but right now her feet is a little swollen. It's going down because we take her to the doctor and she got the LASIK, and but sometimes she keep up, and then she's 93. So I was wondering if kidney and all too could play a part in having the foot swollen, not so?
So remember we discussed a little while ago, we talked in one of the PowerPoints about the complications of having a heart attack. And one of them is heart failure. With her age, she most likely would have had a heart attack and not know about it. And that would have caused damage. So because the damage was there, she started having congestive cardiac failure, which is what she has right now. So that's contributing to her swelling, which is what which is why she's on diuretics. So she's having the Lasix. And once you're taking Lasix, the thing about Lasix, what it does, now I remember taking Lasix at one point in time because I was a young junior nurse and they said Lasix is good for weight loss. So stupid me, I was not a registered nurse as yet, I was a student nurse, and stupid me gonna take the Lasix. And when I took the Lasix, it made me pass a lot of urine and I was just peeing like crazy. And I was working and peeing, and I wasn't drinking water. And the thing about Lasix, for those of you who take Lasix, you would realize that you get dryness in the mouth. It's one of the side effects.
Right.
And yes, you get dryness, your mouth feel real dry. And then the next day, you don't pass urine at all. So it means that it's shutting down the kidneys. And this is what Lasix does. And these are some of the things that doctors don't educate patients about. That when you're using particular drugs, you have to know how it works in your body. Because Lasix now has to reduce the amount of fluid that you're accumulating. But what it also does is shuts down the kidneys. So that's why you have to have sips of water frequently, so that you having this dryness in the mouth, you don't shut down the kidneys.
Yeah, because right now she's talking about her body itching, you know, as that a cream her down at times, but the body is itching, and someone said that's because of the water.
Does she have renal impairment?
No.
She doesn't have kidney problems?
No,
okay.
I don't think so, yeah.
Because sometimes with the itching, what happens with our skin is that when we start gathering the fluid, it stretches, so the skin will expand because of elasticity. So when it starts expanding and you start gathering the fluid, any sort of swelling you have in your foot, you will feel the itching because it's stretching. So that's quite normal. So at that point in time, if she's not diabetic, you have to watch her because some people real scratch. And when they scratch, the nails itself damages the skin.
Yes, because she had a mole on her back and she dig it out by scratching.
Yeah. So you have to be very careful with her. So you have to get itching creams and lotions and, you know, keep moisturizing the skin so that she doesn't itch. She doesn't itch. Because, and you can mention that to the doctor as well. So you know that they could give her a little itching medication, something to stop it.
Well, I have a cream called what Cetaphil. I think it's Cetaphil or something like that. So we're using that.
That's very good.
Right.
That's very good.
Yeah. Thank you.
Does anyone else have any questions? If not, I'll call on Brother Knox to give us a vote of thanks.
What's that?
That if no one have any more questions, I will call on our dear brother Lennox to give us a vote of thanks.
Okay, sure.
Hi, good afternoon, Mr. Nizam. I will win the vote of thanks.
All right, Kanika, our secretary will give us
a message here. Okay. Good afternoon, everyone, once more.
Good afternoon.
Thank you, Mr. Presiding Officer. Ladies and gentlemen, my name is Kanika Belgrove. I am the secretary for the Larmian Diabetic Support Group. My function this evening is to give the vote of thanks. I must say a special thank you to Miss Melissa Ravello for accepting our invitation to be our guest speaker for this afternoon's meeting, for giving us such an excellent and informative presentation on a topic that we are all familiar with. No, someone with cardiac issues and would have benefited tremendously from your presentation. Thank our presiding officer, Mr. Nizam Hassan Ali, for taking us through the agenda for today's meeting, ensuring that it flowed smoothly. Education Coordinator, Ms. Dira Satnarain, I say thank you for putting together the agenda for today's meeting. In all things, we must invite God Almighty to look over us and give true guidance and blessings. So I thank Ms. Zakia Murray for saying the opening prayer. I thank Ms. Farah Hassan Ali for controlling the technical aspects of today's meeting. Every month, we celebrate all our members who have birthdays in the current month. Hospitality Coordinator, Ms. Anika Kojo, who has the responsibility to send out the cards, post the birthdays in a WhatsApp chat, and recognizing them at our education meetings, I say thank you. I thank members of the support group, inclusive of the directors and the executive officers and the visitors who took the time to log on to Zoom and Facebook, a part of our education meeting. These meetings are for you, so without you, there is no meeting. Thank you for being present. All those persons who will visit our YouTube channel to view the recording of this meeting, I say thank you. But not least, I thank Almighty God for making today's meeting a success and for inspiring the management of the Larman Diabetic Support Group to find more and more innovative ways to better support our members and for continued growth of the support group in this seemingly never-ending pandemic. Thank you.
Thank you very much, Ms. Belgrove, for that vote of thanks. The time is now 5:15, and I now adjourn this meeting until we meet again. Thank you very much again, Ms. Ravello, for being with us. Everyone else for joining us. The program was excellent. We enjoyed it very much, and I'm sure we all gain a lot, and we hope to hear from you very soon again. Thank you again.
No problem. I wish you all the very best. Blessings.
Thank you very much. I now close this meeting. Good afternoon, everyone.
Good afternoon.
After
Good afternoon, everyone.
Thank you. Bye-bye.